Welcome to All Things Policy, a daily podcast by the Takshashila Institution. We are a bunch of policy nerds based in Bengaluru, and we like bringing fresh perspectives to Indian affairs and Indian perspectives to global affairs. So grab a cup of coffee, sit back, and join us for today's chat.
Hello, everyone, and welcome back to another episode of All Things Policy. I am Mariam Azeemuddin, Assistant Program Manager from Tata Institution. And today we dive into an incredibly important topic which many of us can relate to. It's called Mind Matters. And here we're going to dive deep into cortisol and speak about the stress hormone and how it has an impact on our mental health. We're going to be speaking about policy reforms in India and how it's shaping mental health awareness. And to explore this further, we have a very special guest with us, Srividya, who is a research scientist at Tata Institute of Social Sciences. So she's been working tirelessly to help individuals manage stress, anxiety, and other mental health issues. Welcome, Srividya. It's so exciting to have you here.
Thank you so much, Mariam, for having me here. I'm really excited to speak with you today and the conversations revolving around mental health.
Right. So before we dive into cortisol and policy reforms, Srividya, I'd love to hear your journey. And you've been in the field of mental health for a couple of years. And what led you to becoming a research scientist in this field?
It's been a journey, definitely. As a student, I realized the importance of mental health and how much it impacts our personal and academic lives as well. It began from a place from curiosity to just to know more about people and individual differences that play a role in our lives. Taking
Right.
it further professionally, it's been very, very rewarding in individual therapy spaces to see people grow and again how much it impacts their personal and professional lives. At the same time, at a broader policy level, mental health is receiving the kind of recognition it rightly deserves when it comes to the legal frameworks that are being put in place and a lot of activities
Right.
around building awareness in communities. So overall, it has been quite a journey, but definitely a very rewarding one. And I see how valuable it is in the coming future.
Right. It's very inspiring to hear how you've committed yourself to this field. And in your experience, I would like to, just ask you, how have you seen the conversation around mental health evolve in India over the past few years?
That is quite an interesting question, actually. It's definitely evolved a lot. Also, there was a lot of stigma that was present. It still is, that was there earlier.
Right.
Unfortunately, because of the pandemic, a lot of people were pushed into like the more severe end of mental health concerns. But then that also led to a lot of people talking about mental health concerns. That's something we see, like actors and actresses being very open about their diagnosis, which somehow also helps communities and individuals to seek support and seek help that they deserve. So that has definitely played a role. Also, if we notice that public and private players are definitely doing their bit in terms of promoting mental health, we see the public players are coming up with, like, the governments are coming up with schemes and acts to like protect the well-being of individuals. Especially corporates also nowadays have specific like plans to support the well-being of their employees. All of these things are definitely playing a major role, a very crucial role in improving the mental health of all of us.
Great. I mean, then you definitely would like to say there's a step forward in this, I guess.
Definitely, like a lot of work has been done, but a lot of work is still left to do. We see that these policies might be there on like paper, but it hasn't really translated into like actual actionable differences seen in our lives. So that needs to be done.
Got it. So let's talk about cortisol and let's look into the stress hormone that plays a significant role in our mental health. So, Srividya, could you explain what cortisol is and how it affects our mental well being?
So, cortisol is produced by adrenal gland. It is the response to stress. It's essentially how our body responds to stress in a given situation, and our fight or flight response kicks in. It is essentially why a caveman ran when they came across like a lion or tiger, to essentially just save ourselves and
Mhm.
to act upon things. Now, again, this becomes detrimental when it is present for a prolonged period of time. We know that stress or the release of cortisol is essential and important in the short term of things because it helps us act on things instantly. But in the long run, it can be detrimental and also have physiological and psychological consequences. Like we've seen a lot of cardiovascular diseases that have a strong link to the release of cortisol hormone. At the same time, a lot of mental health concerns like anxiety and depression are also linked to this.
Right. Got it. I mean, that's quite of an eye opener for me, and I'm sure to our listeners as well. So, in your practice, how have you seen corporate stress impact individuals' mental health? And yeah, the involvement of cortisol being, involved in this corporate environment specific.
So good you asked, actually, because we see that there is this constant struggle and pressure that a lot of us also sort of go through. We
True.
know that the corporates do pay well, but at the same time, there isn't a lot of job certainty that is present. There is a lot of competition, long working hours lead to chronic stress.
Very true.
A lot of times, because hustle is so hard, all of this stress goes unchecked and not noticed, which then just exasperates into something really large that becomes very overwhelming for us to manage. Again, we know that stigma plays a major role in help seeking, where we do feel ashamed to seek help when
Very
we
true.
rightly deserve to get that kind of help. So, in the long run of things, it will also lead to more severe mental health conditions like anxiety or depression.
And right, and especially with workaholics who over the time I feel the silent suffering can just lead to burnout and anxiety disorders or even depression. I feel like they just get so consumed in the work that they do or into that whole thing of just doing the best or completing something that they really need to the cycle for, and eventually it's just a silent suffering, I would say. And it's so common these days. I mean, I just want to know, are corporates doing enough to support mental health genuinely?
Right. Like we spoke about, right? The culture is very like a perform or perish culture that we see today.
That's right.
To respond to that, again, corporates have begun employee assistance programs that have been initiated. There is like support that people are offering. But I think if we look at this from very like public health perspective, where a very classic like pyramid that we see, where a lot of work is done at the promotion and prevention level, which is why the intervention, the pyramid that we look on top looks a lot more narrow. Comparing that to the EAPs right now,
Right.
corporates aren't doing enough to reduce stigma or increase or promote help seeking, which
Right.
is why there is a lot of like lack of awareness in terms of mental health. There are a lot of myths around mental health which we aren't like sort of myth busting, which is
Very
why
true.
even though we are providing, let's say, individual therapy sessions to our employees, they're not really doing much. And
Right.
again, they're not seeking that help because of the stigma that's already present.
So yes, going into stigma, like you just mentioned, I think we did come across a very breaking news kind of a thing where a very high-end corporate company has, when one of its employees, I think ended their life, and it was stated on the facts of stress that this person went through. And stigma is a massive issue in India, and it's so true that as we speak of stigma, it seems to be so prevalent in India. And how do you think stigma affects mental health awareness in this country? Because clearly people don't speak up, and if at all they do, it's just pushed under the carpet saying, "Oh, I don't think that's stress. I think the person just couldn't cope up to doing something," or "I feel the person's ability is questioned," than actually looking into something
Mhm.
more of how this person is actually being affected in any other way. So yeah, what do you have to say about this?
That's so true. Like you said, let's say if we had to look at it from an urban space, we do begin to question the ability or the efficiency of how well the person is going to work if they have a mental health concern,
Hmm.
which can be led to the point of stigma that we were talking about. This whole feeling of being othered, which we see is prevalent in the rural and urban context. We
Very true.
see maybe stigma could be attributed to like this whole hustle culture that's associated in an urban one, but in a rural context, we see a lot of people think that it's black magic. Like early signs and symptoms of mental health concerns are neglected under the context of like bhoot sawar hai ya fir black magic hui hai.
Very true.
So because of which they don't seek help and support at a much earlier level when the condition could be sort of prevented. Which also reminds me of this one interesting concept, which is called the care gap. Care gap is essentially the gap between the number of professionals that are present and the amount of people who should be receiving support with a mental health concern. And compared to a lot of countries, whether they were high income, low income, or middle income, India was once that had the highest care gap. We have about 60 to 70% of individuals with mental health concerns who don't receive the kind of care they are supposed to be receiving. And a major factor can be contributed to one, of course, stigma and lack of awareness about mental health, signs and symptoms of mental health concerns, and also who to reach out to if we feel that way.
Very true. I mean, that's such an important point that you made. And I mean, it just leads me to think multiple other things as well, how this country really needs some reform. Now, how do you think policy reform like the Mental Health Care Act are shaping the landscape of mental health services in India? I mean, what is your take on this?
Absolutely. It's definitely been a landmark legislation and an act that has been put in place. If we had to again go back to it historically, we've come a long way. We've definitely come a long way, and we need to acknowledge that. Somewhere in like 1912, if I'm not wrong, there was an act that was passed that was called the Indian Lunatic Act, which was extremely detrimental to people with mental health conditions, which essentially focused more on protecting the society from people with mental health conditions, to now the narrative actually changing to a more strengths based, rights based approach where we are actually thinking about and actively working towards protecting the rights and lives of individuals with mental health concerns. So that agency has been given back to the stakeholders, the key stakeholders that it should be with. So that has happened. Again, of course, all good things aside, we also know that when it comes to the actual nitty-gritties and implementation of this particular act, it looks great on paper and it's an excellent act. But again, if I'm looking at like budget allocation, there's less than 0.1% of the budget that has been spent and put for this act. Again, we know, focused on mental health, we know that there aren't even enough mental health professionals to provide support for the communities. Hence, we do need a more sustainable approach to navigate this a little bit better. This could look again, a few ideas could be to involve the communities, because there's only so much urban professionals can honestly do. We should, again, learning from the legislation, give the power back to the people who rightly know more than us. This looks different. Like some programs that have been come up involve community leaders, where the community leader is sensitized about like mental health and like early signs of mental health concerns, who then sort of propagates or spreads the message to their particular like villages or like areas. Because let's say someone in a rural setting would definitely take their leader more seriously and with a lot more credibility than an outsider. So that is one way to work about around it. Another way is also to include ASHA workers, which is actively being done by a lot of NGOs and governmental organizations right now.
I've come across that as well. Yes.
Another innovative idea could also be to take support of like the digital interventions that are up and coming, whether it is through like tele-counseling, teletherapy, or like there are a lot of crisis helpline numbers also, whether that's been run by the government or by like non-profits. We could definitely draw support from these and begin like increase accessibility in some way, or the other. An interesting initiative that is worth sharing is Telemanas. Telemanas is an initiative that's started by the government along with NIMHANS. The helpline number is super easy. It's 14416, and it's a free online sort of telecounseling service that has been initiated. All it requires is like a mobile phone or a telephone to talk to a professional. So
Okay, that's
that's been
great.
quite interesting.
Interesting. I mean, definitely, I was just going to say that as well. So, as you mentioned rural areas earlier, what are the challenges that people in these regions face when it comes to accessing, mental health care? Do we have like a study on that? Do we have
Mhm.
something, some kind of, information on what is it that they actually face?
A general observation, and again going back to what the research says, is there is lack of like understanding and awareness about mental health. That the fact that it is as like real as physical health, so that awareness is not there. Again, vocabulary related to mental health was also a major challenge
Hmm.
navigating that. But another interesting observation that I also made on field was we don't know the rural context enough, to be very honest, to actually provide support. The rural context has a lot of strengths that we can definitely harness very well in our mental health programs and reforms that we undertake, which are somewhere missed out on. So that is something we could. So an interesting like conversation I remember, this was with the teachers who were working in the tribal school, and the
Hmm.
students, where they mentioned ki, generally when we look at like urban professionals coming in, they talk about like general things that lead to stress, whether it's like academic stress, career related anxiety, and all of those things that people keep like talking about.
Hmm.
But if you actually look at the context of here, it's so different. Even if we're starting with something as basic as a textbook, the textbook has so many examples that are so urban that the kids have absolutely like no
No idea.
understanding about, and very rightly so, the context is different. So I think it really boils down to one, understanding what the context is. Of course, there are challenges related to acceptability, feasibility, accessibility that are very rightly like there and need to be highlighted and worked upon. But also understanding the context and then sort of twerking our interventions based on that would be super helpful.
Right. I mean, that's
I
been
don't know, this is too much. I think I just
no,
digressed a
I mean,
lot.
it's been a great, valuable insight for me as well. Like, it's been really great to have, you just given me a lot of knowledge that I've gained in these past few minutes. And so, as we wrap up, Srividya, what advice would you give people, who might be struggling with stress or mental health issues right now? And, or could you, suggest any
Mhm.
quick ways or how to just handle themselves when they're in any situation where they feel it's getting very overwhelming for them?
Sure. Again, like I wouldn't want to sort of jump into generalizations, because I know that there isn't like a one size fit all
Right.
answer to this, but there is help. Like, this is something I really want to like emphasize, that there is help. We just need to ask. Uh, just sort of vent, rant, talk it out to whoever you feel comfortable with, whether it's people in your at home or your friends or co-workers, and express yourself in whatever capacity you can. Don't hold it in before it is very late and it becomes very detrimental for you. So there is help, definitely, like we
Right.
talked about.
So, I mean, you're just saying, and also I feel like there needs to be some kind of, of safe space for people and also to other people for, creating that space for people to just, come and maybe vent or just speak out to if there's something that they're really going through.
Right, absolutely. It kind of reminds me of the topic that policymakers and leaders also need to sort of bring in more awareness about mental health concerns. It is as real as any other concern right now and is very, very prevalent. And that's something we're seeing very loudly in a very disheartening manner in the media. So
Right.
it needs to be a priority for all the leaders we're talking to right now.
Excellent advice. And I mean, it's not a very generalized kind of a thing, but thank you so much for joining us, Srividya, and sharing your valuable perspectives and a lot of knowledge on how things work in this whole field and industry. Mental health truly matters, and having these conversations is so important for raising awareness. And yeah, it's just been a pleasure having you.
Thank you so much for having me, Mariam. It's been a pleasure speaking with you today, and I hope this discussion helps more people understand the importance of taking care of themselves and their well-being.
Yeah. So thank you, listeners, for tuning in. And your mind matters. And that's what we would like to say as we end this podcast. Take care of yourself and take care of the ones in and around you. You just don't know what another person is going through. So just be a little more considerate, maybe, to whoever is in your space. So thank you for this wonderful, insightful journey, and stay tuned for more episodes on All Things Policy, where we continue to explore the critical issues shaping our world. Thank you.
If you liked our show, dive into Takshashila's research on technology, strategy, and economic affairs. Check us out at our Twitter handle @TakshashilaINST or our website takshashila.org.in.